This video explains the chances of complications after a heart transplant. Most heart transplant patients live longer and enjoy a better quality of life than they would have done without the operation. But sadly, not every patient feels better or lives longer after having a heart transplant. The risk of complications can broadly be divided into early risks and later risks. Early risks happen either during surgery or in the days or weeks after a transplant. They are often due to the strain of surgery or poor function of the donor heart. Later risks happen in the months and years after a transplant. These are often related to the immunosuppressing medicines you need to take, or to your immune system damaging your heart despite the medicines. You'll find information about the different risks on our website. It's important to understand how many patients are likely to be affected by each risk. We've divided these risks into different categories depending on how common they are. Very common risks affect more than 10 in 100 patients. Common risks affect between 1 in 100 and 10 in 100 patients. Uncommon risks affect between 1 in 1,000 and 1 in 100 patients, while rare risks affect fewer than 1 in 1,000 patients. This example shows a risk that affects 2 in 100 patients. These risk categories are used to describe the average patient, but every patient is different and your risks may be higher or lower. For example, if you're on blood thinners, you will have a higher risk of bleeding during surgery than someone who isn't. Your transplant team will tell you what they think the risks of heart transplantation are for you. If you are worried about any of the risks mentioned on this website or would like more information, please speak to your transplant team.